Imagine lying on a hospital bed, heart pounding, hands trembling. You've been waiting 9 months for this moment, but nobody told you it would feel this terrifying. Nobody told you that the way your baby enters this world could change as everything. For you, for your body, for your heart. Today, we're going deep into one of the most talked about, most debated, and most misunderstood topics in motherhood: C-section versus normal delivery. Not just the medical facts, but the real stories, the fears, the recovery, the truth that doctors don't always have time to tell you. Stay with me, because by the end of this video, you will know what to ask, what to expect, and how to make the choice that's right for you. Section 1. The two paths. What actually happens? Let's start at the beginning. When a woman goes into labor, there are two main ways a baby can be born. The first, normal delivery, also called vaginal birth. This is the way humans have given birth for thousands of years. The baby travels through the birth canal and into the world. It can take hours. Sometimes it feels like an eternity. The pain is real. The strength it takes, unimaginable. And then the second path, Cesarean section, or C-section, a surgical procedure where doctors make an incision through the mother's abdomen and uterus to deliver the baby. It takes about 10 to 15 minutes for the baby to be born, but the surgery itself, up to an hour, and the recovery. That's where the real journey begins. Neither path is easy. Neither path makes you more or less of a mother, but they are very, very different, and you deserve to know how. Section 2. The emotional truth nobody talks about. Can I be honest with you for a second? There is so much guilt around how a baby is born. Mothers who had C-sections are sometimes made to feel like they took the easy way out. Let me say this clearly. There is nothing easy about having your abdomen cut open while you're awake. Nothing easy about lying on an operating table, arms out, unable to feel your legs. Nothing easy about watching doctors work on the other side of a curtain while you pray your baby is okay. And mothers who had normal deliveries, they carry their own trauma too. The hours of contractions, the tearing, the exhaustion so deep it changes you. Both of these women are warriors. Both of these women deserve to be seen. Section 3. The medical side. Risks, benefits, recovery. Now let's talk about what the science actually tells us. Normal delivery, the benefits. Shorter recovery time. Most women are back on their feet within days. Lower risk of surgical complications. Baby gets exposed to beneficial bacteria in the birth canal, which research suggests supports the immune system. Breastfeeding often starts more easily. Shorter hospital stay. But the challenges are real too. Labor can be long and exhausting, sometimes 12, 18, even 24 hours. There's a risk of tearing that may require stitches. In some cases, emergency interventions are needed: forceps, vacuum, or an unplanned C-section. Pelvic floor issues can develop over time. Section, when it saves lives. And this is important. Sometimes a C-section is not a choice. It's a lifeline. When the baby is in a breech position, when the placenta is blocking the cervix, when the mother's blood pressure is dangerously high, when labor has stalled and the baby is in distress, in these moments, a C-section is not a convenience. It is a miracle of modern medicine. The recovery, though, is harder than most people expect. 4 to 6 weeks before you can drive, lift, or do much. The incision site needs careful care. Pain management is crucial. Some women experience numbness around the scar for months, even years. The emotional processing of a surgical birth can take time. If you had a C-section and felt robbed of the birth you imagined, your feelings are valid. If you had a normal delivery and it was traumatic, your feelings are valid. Healing is healing. Entries are gut. Sacker. Section 4. What about the baby? Here's a question I get asked all the time. Which is better for the baby? The honest answer, it depends. Babies born vaginally are briefly squeezed through the birth canal, which helps clear their lungs of fluid. They're also exposed to the mother's microbiome, bacteria that help build a healthy gut and immune system. Babies born via C-section sometimes need a little extra help clearing their airways. But, and this is important, in cases where a C-section was medically necessary, it is absolutely the safer option for both mother and child. Medical teams today are also exploring something called vaginal seeding, where a swab from the birth canal is applied to a C-section baby's skin to transfer those healthy bacteria. It's still being studied, but it shows how far we've come in understanding what babies need from day one. The most important thing, a baby who arrives safely, and a mother who is alive to hold them. Section 5. Real voices. 2 mothers, 2 stories. Let me tell you about 2 women I want you to picture. The first, let's call her Aisha. She planned for a natural birth. She took the classes, made the birth plan, chose the music, and then at 38 weeks, her baby turned breech, an emergency C-section. She woke up, or rather, lay still, feeling like her birth was taken from her. For weeks, she cried when she saw the scar. But slowly, with support, she came to see it differently. This scar, she said, is where my son came into the world. It's not a wound. It's a door. The second woman, let's call her Sarah. She pushed for 4 hours. No epidural, her choice. She tore. She bled. She shook. And when her daughter was placed on her chest, she felt something she had no words for. But the weeks that followed were brutal. The healing, the pain, the sleepless nights. Nobody told me, she said, that it would hurt like this for this long. Both women are good mothers. Both women went through something profound, and both women needed and deserved more support than they got. Section 6. How to make your decision. So how do you decide? Here's what I want you to take away from this video. 1. Trust your medical team, but ask questions. What are the risks in my specific case? What are my options? What happens if I wait? 2. A planned C-section is different from an emergency C-section. If you have the time and it's medically appropriate, you have the right to understand your options. 3. Your birth story is yours. However, your baby comes into this world, surgically or naturally, with an epidural or without, planned or unplanned. It is valid. It is real. And it is yours. And 4. Prepare for recovery, not just delivery. Most people spend 9 months preparing for the birth and 9 minutes preparing for what comes after. Recovery is part of the journey. Honor it. And 5. You are not alone. Whatever you're feeling, fear, grief, joy, confusion, millions of women have felt it before you. Talk to someone. A doctor, a midwife, a therapist, another mother. If this video helped you, even a little, if it made you feel seen or gave you something to think about, please hit that like button. It truly helps this channel reach more mothers who need it. Share this with a pregnant friend, a sister, a wife, because every woman deserves to walk into that delivery room informed and empowered. Subscribe if you want more honest conversations about motherhood, health, and the things we don't always say out loud. I'll see you in the next one. And to every mother watching, no matter how your baby came into this world, you did something extraordinary.